Hello, everyone, and welcome back to CBS 12 News at 3. Right now, families are struggling with finding affordable health care. One car accident, even cancer, or a traumatic brain injury can put families in financial ruin. And joining us live this afternoon, we have Ryckis, whose personal life story turned her into a champion for finding affordable health care. Chelsea, thank you so much for being here. We appreciate that. We hear you have an incredible story. Please share that with us.
Absolutely. In college, I played NCAA Division I softball, where I sustained a brain injury. And unfortunately, instead of having the time to recover, I was trying to pay off medical bills, and I was waitressing, literally wearing earplugs because I couldn't handle the noise of the clinking plates in an effort to pay off my medical bills. Being that I was from Canada, this was my first interaction with the American healthcare system, and I learned very quickly what medical debt is and what it's like to navigate this confusing system.
Chelsea, I'm so sorry you went through that. And look at what you had to do to help pay for bills. So this is probably why you are so passionate about helping employees about affordable health care. Tell us a little bit how you're doing that.
Yeah. 181 million Americans rely on their companies that they work for their health insurance. So in order to make the biggest impact and the biggest change, that's where I focus. So I'm going to be working with American employers and helping them create long-term sustainable health care plans so that their employees have access to affordable health care.
What are some of the secrets to being able to afford affordable health care for employees? I'm sure a lot of people at home are probably shaking their heads. It's expensive out there.
It is. And so there's a couple. I'll focus on prescriptions, because that's a huge topic right now with legislation, and you've probably heard Mark Cuban talking about prescriptions. A lot of people are talking about it. Number one, GoodRx. And a lot of people know about this. So this is an online tool. They have an app, and it's a price comparison tool. So let's say you have a generic or a specialty drug, you can actually log into the app and see which pharmacy to go to and get up over 80% savings. So that's number one. And then number two, premium assistance programs or patient assistant programs through manufacturers of drugs. They will actually give patients drugs at no cost if they're within a certain income threshold.
Those are some good tips right there. You got to remember that. Talk to us a little bit about what is the biggest difference that you have been able to make for American employees and for employers.
There's a lot of them that are really important, but I think the most rewarding is when we get to have employees go and get free cancer treatments, free surgeries. We just had an employee here in Florida. He needed a skin graft on his finger. He was bit by a spider. He went to the hospital and they told him $53,000 for your surgery for a skin graft. The same doctor, the same procedure at a different facility, $2,000.
Why do you think there's such a big difference there as far as costs? It's a huge variation here.
So ultimately, when it comes to hospital pricing, they're going to charge what the market will bear. And the thing about this country and healthcare is there is not a price per service. So not every knee surgery, not every MRI is going to be the same price. There's a price depending on who is paying. Wow. It's absolutely wild. So that's why it's so important for employers and employees to advocate for themselves, to use certain tools to learn and be like true pioneers of their own health. And I do have a lot of resources on my website that people can use and look at to help them navigate this complex system.
Thank you so much for sharing some of these tips here at CBS 12. But what is next for you? How are you going to expand and share some of these tips and just your learning experience from all this?
Great question. So we actually just produced, my husband and I, the owners of Ethos, a healthcare documentary, and it's going to be airing on streaming platforms later this year, but it essentially dispels the big lie, which is employers and employees cannot control the cost of their health insurance. It's simply not true, and this documentary shows them how.
I love it. It's going to show them how, and hopefully we could fix this problem. Seems like a lot of people are experiencing this, and nobody wants to go through something like what you did, right? You're trying to heal, but you're also trying to pay these health bills. Thank you so much for being here. We appreciate that, and we'll be right back.